Okay, this is June Adams Nursing 5020 Health History video. Hi, Mr. Adams. My name is June, and I am your clinical nurse specialist working with Dr. DeVello, and I will be completing your examination today. If you can bear with me, I will start out asking you questions about your health history, and then we will go into the actual physical exam. So for right now, you may remain dressed as you are. The entire process will take about an hour. Do you have time?
The Cavs game come on later, but I got time.
Okay, thank you so much. I appreciate you carving out this time in your schedule. It is my goal to know you while you are well, so that when you become ill, I can give you the best care possible. So what brings you in today?
I have a serious headache that I've developed from football practice.
And when did it begin?
Probably about a week now. It's just like a head-on collision, then it just had been right since.
So you were playing football and you were tackled, or you tackled somebody, and then the headache started after that?
I was tackled and I hit my head back on the ground, and it kind of bounced off the ground.
Did you lose consciousness?
Just for about blacked out for a good 2 or 3 seconds, and then came to after.
Did you see any doctor after that happened?
No, I just sat down for a while. Just took a couple days off.
Have you played football since then?
I tried it once, but the whole contact thing, it just started all over again.
So when the headache, is it constant or does it come and go since that time?
Just depending on what I'm doing, whether I'm running, just like the pounding of my feet hitting the ground, it kind of like just makes my head just hurt a little more.
So when you're asleep, do you have a headache?
I've never been woken out of my sleep to it, but it's just when I'm up and active, and then.
So do you have to be physically active, or can you be walking?
Well, walking is fine. It depends on what I'm walking. Just walking straight line is fine. Like walking up and down the stairs, then I can sort of feel it. Or if I start to run, or so.
Now, if you're watching TV, do you get a headache? Does it come?
Not so much watching TV. Just if I'm just, it's just random times throughout the day that it happens. Just not really just a pinpoint time thing. Besides being active.
So how long does it last when the headache comes?
So say like if the time I try to go back to play football, and I just want to just do a regular normal tackle that didn't hit my head or anything, it flared up. Probably lasts for about like a strong 30 seconds of like burning, like pounding sensation in the side of my head.
Is the pain all over your head or in a certain spot?
Kind of like dead in the center, so it feels like it's all over.
Does anything help make it go away or make it worse?
Just time.
So in the time that it's going away, are you laying down or sitting down, or as long as you stop activity, it'll stop?
Yeah.
And does it occur? So you said the headache has come after you were playing football. It's pretty much just when you're active, it comes for about 30 seconds. It's a dull, it's a burning, pounding pain. Nothing makes it worse other than activity. And the only thing that really makes it better is when you stop doing the activity.
Right.
Have you taken any medicine to help?
Just like Motrin or ibuprofen, or just basically that. Anything over the counter.
Does it help?
No, not really.
How much Motrin have you been taking? Say in a day, how many tablets have you taken?
4 or 5.
And on a scale of 0 to 10, with 10 being the greatest pain and 0 being the least, how would you rate this pain when it comes on?
7, 8, 7.5, so in the area.
And is it always a 7 to 8 when it comes on, or does it?
Yeah, it's the same pain every time.
Okay. Okay, so next I want to ask you some questions. We're going to come back to this when I do your physical assessment. I'm going to ask you some questions about your past medical history, just to give me a full picture of your health. So have you had Any childhood immunizations for measles, mumps, or rubella?
No.
Um, Diphtheria, tetanus, or pertussis?
No.
Have you had chickenpox?
Yeah.
Rheumatic or scarlet fever?
No.
Polio?
No.
Do you recall getting these immunizations as a child?
Just chickenpox, and I don't remember none of the other stuff.
I will see if I can get your old record, because most of the time if you've been in school, these are mandatory immunizations. So I'm thinking you probably have had them, you were just too young to remember, but I will check to be sure. Have you had TB or hepatitis that you know of?
No.
Any problems with diabetes or high blood pressure?
No.
Any tropical or parasitic diseases that you know of?
No.
You haven't traveled? Have you traveled out of the country?
No.
Okay. Any past surgeries or hospitalizations?
Just thumb surgery. I had a few surgeries like on my knees and thumb and stitches.
Let's start with your thumb. What happened to that?
Playing football, I got stuck in the ground and dislocated it.
Which thumb?
Left.
And how's it working for you now?
It's fine now.
Okay, and then which knee?
Left.
And how many surgeries have you had to the knee?
5.
And what kind of surgeries were they? Do you remember?
Meniscus.
And how's your knee right now?
Still recovering.
When was your last surgery on your knee?
August 8th, 2014.
And then when was your thumb surgery, if you can remember?
August 10th, 2008. 7.
Okay. So you're not sure about your immunizations, but I'm thinking you've had them, and we can check with Dr. DeVello. She's listed as your pediatrician to see just when you had those last. Do you take any medications right now other than the Motrin for these headaches?
No.
Do you have any allergies to any medicine or food?
No.
Do you take any other drugs that are not prescribed, like vitamins or oral supplements?
No.
Do you have any food allergies?
No.
Any issues with latex?
No.
Okay. So this next section is questions about your family history. Some diseases are genetically linked, and this will help give me this will help me be able to take care of you long term, because we can look ahead and take a proactive approach to your health care. So your parents, are they living?
Yes.
Okay. How's their health?
Fine that I know of.
How about your grandparents? Are they living on both sides?
One is and one isn't.
The one that is not, what did he or she die of?
Cancer.
You know what kind of cancer?
No.
Was it a grandmother or grandfather?
Grandfather.
So your grandmother on both sides are living?
Yes.
And how's their health that you know of?
I'm not too sure. I just know they still kicking.
Okay. Do you have any siblings?
Yeah.
How many do you have?
4.
And how are they all living?
Yeah.
How's their health that you know of?
Fine.
Okay. What number child are you?
3rd.
Do you have any children?
No. Not that I know of.
Do you have any illnesses that affect you, your siblings, your parents, or your grandparents, such as cancer? You said your grandfather died of cancer, but you don't know what type.
No.
Any heart disease in any of these generations? High blood pressure?
My dad.
Diabetes?
My grandma.
Your maternal grandmother or your father's mother?
Maternal.
Any strokes?
Not that I know of.
Any seizure disorder?
No.
Or gout?
No.
Kidney disease?
No.
Any genetic disorders that you know
That I don't know.
of? Any thyroid disease in any of these generations?
No.
Any respiratory illnesses such as asthma or
No.
COPD? Any types of arthritis?
No.
Any blood diseases that you know of?
No.
Like leukemia? Any sexually transmitted diseases?
No.
Any family diseases or anything that I have not named?
No.
Okay. A lot of times in the African American community, these illnesses aren't passed on in the history of the family, you know. So when you go home, it might behoove you to talk to your grandparents about what illnesses they do have, because usually that generation of people don't really discuss their illnesses, because some things are genetically linked, like the hypertension that your father has. That would be something that we would look at down the road to make sure that it's not happening to you, because a lot of times you don't have any symptoms until it's really high, and we'll want to keep an eye on that. So next we're going to ask some questions about your social history. Some of these questions may seem very personal, but again, they are so I can give you the best possible care long term. So is there any clergy person or faith community nurse in your congregation that you would like included in your care?
Nope.
Are there any cultural or spiritual concerns you have that would help me to better take care of you?
No.
Okay. Do you work or go to school?
Work.
How many hours do you work?
40 a week.
And are you exposed to any chemicals, toxins, poisons, asbestos, or radioactive material at your job?
No.
Are you exposed to extremes of hot and cold at your job?
Yeah.
Or at home?
Yeah, at the job.
What extremes, hot or cold?
Just whatever the weather brings, it's all outdoors.
So you work outdoors. So what do you do to protect yourself from the weather?
Just cool in the winter, bundle up in the vice versa.
Okay. How would you describe your relationships with your family, friends, and coworkers?
It's about average.
How would you describe your diet?
Terrible.
What's a typical day's food for you?
Cereal in the morning. About 12 o'clock, a pack of ramen noodles. Then about 4 o'clock, some McDonald's. 7 o'clock, another some Taco Bell. And probably some more noodles later on at night or something. Anything that can be made under 5 minutes.
Sounds like a typical young person's diet.
Mm-hmm.
Do you play any sports currently, or did you play any sports other than the football you told me about?
I don't play any sports now. It's just the football thing happened. Just something just playing around. But the sports I played football, basketball, and ran track a while ago.
Do you have any opportunities currently to exercise other than the job? You said it's outside.
Yeah, I have the opportunity to, yeah.
Do you exercise?
Not as much as I should.
Do you use energy drinks or caffeine to get through your day?
No.
How many hours of sleep would you say you get in a 24-hour period?
5.
And then let's go back to your job that you said is outside. What hours is that? What hours do you work?
7:30 to 4 in the morning.
7:30 p.m. to 4 in the morning?
Yep.
Do you use anything to keep yourself awake at that time?
No.
Okay. And so far that's working for you you're not fatigued during the day?
No.
Okay, do you smoke?
No.
Do you drink?
Barely.
What do you drink?
Beer here and there, and then alcohol every once in a while. Nothing that's a habit. Probably a few times out of the year.
A few times out of the year. So in a week's time, how much would you say you drink?
Probably not. Probably won't drink in a week. Probably in a month's time. Probably like once every 3 months or so.
Has anyone expressed a concern